Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Hi everyone. Today we are going to talk about Bactrim, a medication made up of sulfamethoxazole and trimethoprim, and how to use it safely and effectively. Bactrim is an antibiotic that fights different infections caused by bacteria, such as urinary tract infections, respiratory infections, and some gastrointestinal infections. To get the best results, it's important to follow your doctor's instructions exactly. So how does Bactrim work? This medicine combines two active substances that work together to stop the growth of bacteria. By preventing bacteria from multiplying, Bactrim helps your body fight off the infection. Regarding the dosage, Bactrim is usually taken by mouth. The starting and maintenance doses may vary, but the most common is to take it twice a day. Be sure to follow your doctor's instructions carefully and do not stop treatment early, even if you feel better. As with any medication, it is important to be aware of possible side effects. Some of the most common include nausea, vomiting, and skin rashes. If you experience any of these symptoms or any other negative reaction, contact your doctor immediately. Also, tell your doctor about any other medications you are taking to avoid unwanted interactions. In summary, Bactrim is a powerful tool to fight bacterial infections as long as it is used under proper medical supervision. Remember to take it as directed and watch for any side effects. Thanks for watching this video. Don't forget to give it a thumbs up, subscribe to our channel, and share this information with anyone who may need it. See you next time.
If you've made it this far, let us know in the comments why you're using this medicine.